Okay, so this is basically means that when you exert stress to your bladder is unable to control, the sphincter is unable to control the urine, and therefore you have leakages of urine when you exert yourself. Typically, when you are coughing and sneezing, or when you're exercising, walking, or chasing the bus. So it is very more common in female because of our lack of complex sphincter support to the bladder. So for women, our urinary continence is supported by the pelvic floor muscle. And these pelvic floor muscles can be weakened during pregnancy, childbirth, or certain women who has undergone hysterectomy or removal of the womb. For men, because they have a better control of their urinary sphincter, so it is not easy for men to suffer from urinary incontinence unless they have gone for some kind of surgery to the prostate area. The most commonly would be prostatectomy for prostate cancer, radiotherapy for prostate cancer, or some kind of prostate surgery for urine problem or prostate problem. Next. So when the patient come to us, the test that we do is, number one, we have to determine how your strength of your pelvic floor muscle, and then after that we must make sure that it is not infection or other more serious causes to the urinary leakage. After we have determined what kind of urinary incontinence, then we want to know how severe it is. So we use a bladder diary, we use PET test, and we use urodynamic study. Okay, so once you have determined this is stress urinary incontinence, then we always adopt we call it a stepwise approach. That means we do the most basic, which includes strengthening your pelvic floor muscle by doing exercises. And then we move up to surgical intervention. There's no good medication for stress urinary incontinence. For surgery, we also have a different kind of surgery for different women at their different stages of life and whether they have completed their family. Next.
Terima kasih telah menonton video ini. Jangan lupa subscribe channel Tekon TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.